This program is proudly brought to you by Drugnet, your #1 online pharmacy, and the Pharmaceutical Society of Ghana, supported by Seafort, your best vitamin C supplement from Samu's Pharma. It's another new weekend. You know what that means. Ask Your Pharmacist is here to give you all the education you need to keep fit and to stay healthy. My name is Peggy Sano and I'm your host. This show is proudly brought to you by Drugnet, your #1 online pharmacy, and the Pharmaceutical Society of Ghana, supported by Seafort, the best vitamin C plus zinc from Samu's Pharma. If you need to boost your immune system, this is the right vitamin C plus zinc to get. This is also brought to you by our media sponsors. Thank you to them, GH1 Television and ETV Ghana. We are going on a quick break. I will come back, introduce our location for today, guest pharmacist, and our topic. Do not go anywhere. I'll be right back.
Are you tired of roaming for your medications and can't find them? Sick and alone and can't get anyone to get your drugs? Do you need to talk to a pharmacist? Or do you feel uncomfortable when buying certain drugs from the pharmacy? Do you want your drugs to be delivered to you at the comfort of your own home or office? Then it's time to download the Drugnet app, spelled DRUGNET, from the Play Store or the App Store to enjoy total convenience. Use Drugnet, your #1 online pharmacy. For further inquiries on Drugnet, call 024 00 24455.
Thank you so much for staying tuned. You are watching Ask Your Pharmacist on Drugnet TV. Today we are at Teshi First Junction, and our guest pharmacist for today is Pharm Dr. Richmond Ama. He's also the president of the Young Pharmacist Group of Ghana. And our topic for discussion is rational use of drugs. Pharm Doctor, how are you doing today?
I'm doing fine. How about you?
Well, I'm doing very well. So why the need for us to discuss the rational use of drugs?
I think there is a menace around, and a few of research that we have done over the years has indicates that lots of people do abuse drugs. Talking about the rational use of drugs, I mean the drugs that are being bought from the pharmacies, even drugs that are gotten from the hospitals. People take it anyhow that they like it, and it rather affects them in a negative way than they optimizing the need to get a good outcome from the drug. So, One Love, I want to ask you about the rational use of drugs. Today we want to look at drug abuse. And so if you say rational use of drugs, what is your understanding about that?
I guess if we're talking about maybe legal drugs, it's using the drugs above or below the requirement, which is probably stated by the pharmacist or doctor. And then when it comes to, I guess, illegal drugs, I guess any use of illegal drugs is irrational.
Okay.
And but because we should know that drugs change our chemistry and make our bodies function differently. And so maybe too much of it pushes our body in a certain way that we may not be able to come back from.
Okay.
Yeah.
Wow, that is very brilliant. You seem like a science student already. Do you have any question to ask me regarding what we have just discussed?
Yes, please. I think the small science I learned was from Gast. I don't know if you remember that book. Gast. Yes. Okay. Yes, but that time it was SSS, the time I was there.
Yes.
Okay. I have a question about a drug I use quite often called Travacort, because I have a skin condition called seborrhea.
Okay.
And so when I eat rice or sugar or cakes, pastries, actually I'm not allowed to eat like wache, rice, umutu, because my skin develops some kind of dandruff.
Okay.
And the only cream that I've seen that removes it is Travacort. It makes it go away quite quickly. But I am not clear on the limitations or the abuse of that. So that's what my question will be about.
Yeah, that's very wonderful. But before I answer, who recommended or prescribed that drug for you?
Yes, I think it was recommended by, I'm confused about it. It's either Rabito clinic or a clinic in Romania that said that that's something that can help, but it's been years ago, and they had told me I should use it like one tube, not more than like a tube for I don't know how many months. But sometimes because of my diet, I eat and then I have to use it to hide, to conceal the seborrhea, and so I feel like I do abuse it. So I wanted to just know if you could help me with the guidelines so that I don't, and what can happen if I'm using it too much.
So it was recommended for you that whenever you get that kind of allergic reaction, you just apply it. So we apply it when unknowingly you eat from somewhere and then you get that form of reaction. So you use it when needed. That is when you get any form of reaction, that is when you would use. But then what we will recommend is that we want you to be very careful on the kind of drugs and then the kind of food and everything that you take, because it can trigger the condition that you are saying. Yes. And so just be careful and then prevent, rather than taking the food and then getting the reaction for you to apply. It's quite unfortunate. You may have to apply it whenever that you get the reaction. It is not really going to cure the condition in a way, but then it is being given so that the condition or the triggering effect will be limited or reduced at that particular time.
So in case you are sick and somebody asks you to go and take paracetamol, do you go to pharmacy and buy the paracetamol, or what do you do? Do you have to seek advice from the doctor, or at least what's your advice on it?
So what I'm going to advise you is that the kind of sickness doesn't really, somebody must know. So just go to the pharmacy and talk to the pharmacist. The pharmacist, looking at or taking your history or anything, how you speak, will know whether the condition is something that can be treated in the pharmacy or it is something that you would have to go to the hospital. So go to the pharmacy. Don't say I'm coming to buy this. Talk to your pharmacist that, okay, this is what is happening to me, and the pharmacist will advise you whether you are supposed to take a particular drug there or you are supposed to go to the hospital.
Okay. But on person who effect of painkillers, what it does to your body, because I've heard that it gives problems to our liver and it have other side effects which are very dangerous. So I want to find out why.
Okay, so this is a very good question that you were asking. Painkillers, especially paracetamol, has a very good effect on the body, but it also has a negative effect, and that is it can lead to perforate the liver and lead to liver cirrhosis, that is cancer. And you know that when your liver more than 60% is damaged, it can never be replaced and it can lead to death.
I did China ye free hospital. A dread the mammy bano no ma or da party woman no for crown to me and see 1 week a hospital nurse in the Swati. Nurse me cry my America say a drone and I me church me kuma and the Kayam said there be a drone and young college route. Mammy money pure.
Okay. Thank you, Medase. Say what baby says our question way. Ya fast aquania so and the Kasach say yeah hunina and even more amame for no bia munum drono. Inti satam no so nanka as say hona so no odi akwane the hospital say Jumadia dona the man no de ye ni akwane to me and no for the bia dan or dasa antinka now there or share the dear don man na waboa wa hwe.
Hey Kofi, are you coming to the party? Everyone is here.
Oh, Mido, I'm not well low and I feel too weak to go out and get drugs.
Oh, Kofi, why the hassle? You can order all your drugs on the Drugnet app.
Drugnet app?
Yes, Drugnet app. I don't stress myself any longer. I just go on the app and upload all my prescriptions or call the pharmacist on the app and my drugs are sent to me at a fee of only 5 cedis.
Wow, this is amazing. I feel better already.
It is time to download the Drugnet app
on Google Play Store or the App Store and enjoy total convenience.
Drugnet, your #1 online pharmacy.
I wanted to also have a few or a great definition of what drug is, because I know pharmacists, you guys are like the connoisseurs of drugs. You guys are know everything about drugs pretty much. So I wanted to know what drugs are. Viewers want to know what drugs are, just in case they know that whatever they are taking is something that needs to be really educated on.
I always say that pharmacists are custodian of drugs. If anything is supposed to happen to a drug or medicine, is the pharmacist that is the first person to know. So drugs, let me say for short, they are chemical compounds that are synthesized in the lab. Others are made from plants that are synthesized to cure a particular disease or condition in the body.
So drug is basically something very huge that everybody needs to be very mindful of before they take it. But I know you did talk briefly about the rational use of drugs, so I want us to kind of link the two. So why do we have to take drug rationally?
Yeah, there is the need to take drugs rationally because, as I said early on, drugs are supposed to correct a condition in the body. But then if you do not take it at the time that you are supposed to take it and for the right condition, it will really affect you negatively, and then you will have the consequences of it. I will take the opportunity now to even give you the definition for the rational use of drugs. So we say that using the right drug for the right indication, that is the disease, at the right time, by the right patient, and then for the right dosage. So somebody recommended it for me, and I am taking it as the person has recommended that I'm supposed to take.
Okay, so I want to talk about the recommendation. You said somebody recommended to me. Could it be like, oh, my head is aching, and somebody goes, oh, just take paracetamol, just take something? Is that kind of recommendation? It has to be coming from a particular source?
Yes, very, very important. So two people have the right to recommend drugs worldwide. Number one is the doctor. Number two is the pharmacist. So the doctor can do the recommendation in the hospital. When you come to the community pharmacies, pharmacists are at post. So when you need any treatment in terms of a condition, you go and then see the pharmacist. So the pharmacist can also recommend drugs for you within the pharmacy, and then also give you the guidelines. Even when the doctor recommends a drug, the prescription goes to the pharmacist, and the pharmacist will indicate that this is the drug that I'm giving you, and the pharmacist will tell you how to take the drug, the duration that you are supposed to take the drug, when to stop, when not to stop.
Okay, so there you have it. Two kind of people have to recommend. It's the doctor and your pharmacist. Do not self-medicate. Don't let anybody recommend to you unless it's coming from your pharmacist or your doctor. So, Doc, I want us to keep talking about the dangers of... So I would want to believe that if it's not rational, then it's an abuse. So let's talk about the dangers of that.
Yeah, so let me now coin it to irrational. So the irrational use, I want to take a specific an example. When you are at the pharmacy, I've done community pharmacy for so many years. When you are at the pharmacy, people come and then will say, I'm buying F-Pack. Excuse me and permit me to use the names because that is what we are seeing here on the market. So F-Pack, the EF is the name of the person that produced it. The PAC contains paracetamol, aspirin, and then caffeine. Somebody can buy that and buy another drug like APC. Akuma APC, the A stands for aspirin, P stands for paracetamol, C stands for caffeine. And so people can combine them and then take it because they are having severe body aches or fever or something and they want to hit it hard. And so they combine these things and then take it. So when you look at it, that means you are taking double doses of the drugs by each of the producers. So it is an irrational form. It is something that is going on the market. Some will also go around and then say that, oh, when I went to the hospital, my doctor gave me this medication. So if you are complaining of this kind of condition, then okay, so this is what was wrong with me. So let me also give you the same drug, but we are all different. Even twins are not the same, and then drugs works differently in every individual.
Okay, so Doc, let's talk about the herbal drugs, because usually people tend to think as though herbal drugs, you can abuse herbal drugs or you cannot have any side effects. So let's touch on that real quick.
You are pushing me somewhere, but then it is very important and it's imperative that I talk about it. So herbal drugs are good. Herbal drugs may not be good. And so I would recommend that when you are taking herbal medication, take herbal medication from a very good source.
Okay, so the good thing about herbal drugs is that these days you can find them in pharmacies. So, it's always better you go talk to a pharmacist and they can recommend the best herbal drugs for you. Okay, Doc, finally, I want us to wrap up, but let's talk about ways we can ensure that we are not, rationally or irrationally abusing our drugs. What can we do to prevent all of that?
I want to advise the general public that let us try and then cut down before you take any form of drug. Tell your pharmacist. He is the custodian of every drug. Or go to the hospital and then speak to your doctor. And then the doctor, together with the pharmacist and the other healthcare team, will help and look at you and say that this is what will help you when you recommend it for you.
Okay, so your pharmacist is a custodian of every drug. So every medication you need, the pharmacist will be the right person to tell you how to take it, when to take it, and even if it's the best for you. Just so you don't find yourself self-medicating, please always ask your pharmacist because they know more and they would be more helpful to you. Thank you. Dose for Healthy Living is up next. Do not go anywhere. Today on Dose for Healthy Living, avoid mixing. Don't mix your medications with food or drink unless instructed to by a pharmacist or a doctor. This is where we bring today's episode of Ask Your Pharmacist to an end. I really hope you did learn a lot. This show was proudly brought to you by Drugnet, your #1 online pharmacy. You can download the Drugnet app on Google Play Store or the App Store, order all your medications, speak to a pharmacist, and have them delivered to you. This is also brought to you by the Pharmaceutical Society of Ghana, supported by VitC4, the best vitamin C supplement to boost your immune system. And this is from Samus Pharma Limited. Thank you to our media sponsors, ETV Ghana and GH1 Television. Like I always say, ask your pharmacist because whatever that goes inside of you is merely irreversible. My name is Peggy Sano. I will be coming your way same time next week. Until then, be safe and bye-bye.